In this instructional video, we'll review superficial and deep parasternal blocks. Both superficial and deep parasternal blocks provide midline analgesia to the chest wall by blocking the anterior cutaneous branches of the T2 to T6 intercostal nerves. We'll start with the transducer over the sternum in the sagittal orientation. As we move lateral, we see the transition from the bright white line of the sternum to costal cartilage. From superficial to deep, we have pec major, intercostal, and transversus thoracis muscles. The transversus thoracis muscle is very thin and may not be well visualized. As we turn the probe from the sagittal to transverse orientation, we can appreciate the mammary vessels seen here in cross-section below the intercostal muscle. To perform the superficial parasternal block, local anesthetic is placed in the fascial plane between pec major and intercostal muscles. For most adult patients, we'll place 2 equidistant injections of 10 mL of dilute local anesthetic on each side of the sternum for a total of 40 mL across 4 injections. Be mindful to stay under the maximum recommended dose of local anesthetic, especially with large volume blocks. Compared to the deep approach, the superficial parasternal block has a safety advantage of being further away from the mammary vessels and pleura. However, there's more resistance to spread in the plane above intercostal muscle compared to below, and more injections are likely required to achieve T2 to T6 spread as demonstrated in this cadaver study. For the deep parasternal block, we'll slide back to the transverse orientation so that we can more easily identify the mammary vessels in cross-section. With careful hydrodissection, local anesthetic is placed below the intercostal muscle, avoiding injury to the mammary vessels or pleura. For most adult patients, we'll place 1 injection of 10 to 15 mL of dilute local anesthetic on each side of the sternum. This brings us to a total volume of 20 to 30 mL of local anesthetic across 2 injections, again being mindful of the maximum recommended dose. Compared to the superficial approach, there's less resistance to local anesthetic spread with the deep parasternal block, and T2 to T6 analgesia is often achieved with just 1 injection on either side of the sternum. The deep approach is an advanced technique. Careful hydrodissection with in-plane needle visualization at all times is recommended to avoid injury to the mammary vessels and pleura.